Good morning, everyone. I am Dr. Ahmad from GEMS College. My topic is study on outcomes of intravitreal bevacizumab in treatment of diabetic macular edema. Introduction. Diabetes mellitus is a metabolic disease known in ancient times. Diabetic population in India is thought to be estimated as 69.9 million by 2025 and 80 million by 2030. The global prevalence of diabetic retinopathy and diabetic macular edema were 27% for any diabetic retinopathy, comprising of 25.2% NPDR with 1.4% PDR and 4.6% diabetic macular edema during 2015 to 2019. Diabetic macular edema is one of the major cause of loss of central vision and visual acuity in diabetic patients. Clinically significant macular edema is defined as the retinal edema and hard exudates within 500 micrometers of the center of macula, and retinal edema of one disc diameter or larger, any part of which is within one disc diameter of center of macula. Up to 10% of all the patients with diabetes will develop diabetic macular edema during their lifetime. The Wisconsin epidemiological study of diabetic retinopathy found the 14-year incidence of diabetic macular edema in type 1 diabetes to be 26%. Prevalence of diabetic macular edema is more in NPDR and increases with the severity. Vascular endothelial growth factor has shown to be critical stimulus in the pathogenesis of macular edema secondary to diabetes. Diabetic macular edema commonly leads to visual loss in the patients of diabetic mellitus, and this loss of vision can be irreversible. Increased in the vascular permeability due to diabetic results in the leakage of fluid in the plasma constituents into the retina, leading to diabetic macular edema. The ETDRS reveals that focal laser photocoagulation plays a beneficial role and reduces the rate of moderate visual loss by 50%. Patients having media opacity like cataract at times make it impossible for the doctor to do complete macular grid laser, so there is need of alternative adjunctive treatment. VEGF was discovered in 1989. Hypoxia stimulates the normal retinal pigment epithelium cells to secrete VEGF. Eyes having diabetic macular edema have significantly elevated levels of VEGF. It is observed that eyes with heavy macular leakage have significantly higher VEGF concentration as compared to eyes with less leakage. Therefore, anti-VEGF treatment can be considered as an adjunctive treatment for DME. Bevacizumab is a full-length antibody that inhibits all isoforms of VEGF-A family. It is licensed by FDA for treatment of colorectal carcinoma. The objective of my study is to study the efficacy and safety of intravitreal bevacizumab in treatment of diabetic macular edema. Inclusion criteria: patients with presence of clinically significant macular edema in both PDR and NPDR with no prior treatment, patients of either gender with any age, duration and level and control and severity of the diabetes, and central retinal thickness on OCT showing greater than 250 microns or presence of cystic spaces, and best corrected vision pre-treatment should be worse than 612. Exclusion criteria: macular edema secondary to causes other than diabetic retinopathy, vision loss secondary to cause other than diabetic macular edema, diabetic macular edema previously treated with intravitreal triamcinolone or other anti-VEGF agents, previous history of focal or grid laser, corneal diseases, inflammatory eye diseases, optic neuropathy and age-related macular degeneration, any ocular surgery in past 6 months, if patient is having uncontrolled hypertension or thromboembolic events, or in pregnant. My materials and methods, sir. It is a hospital-based prospective interventional study conducted at GEMS Hospital Ophthalmology Department, Ragolu, Srikakulam. Patients are selected based on the inclusion and exclusion criteria. A total of 27 eyes of 27 patients with diabetic macular edema. Those who are undergoing intravitreal bevacizumab injections for DME were included from January 2023 to July 23. Patients are having either gender and aging between 48 to 70 years. After explaining the purpose and procedure of my study, informed consent was taken. All the patients are examined by me to minimize the bias. Detailed medical history, clinical examination, which includes visual acuity, slit lamp examination of the anterior segment and posterior segment using 90D lens, posterior segment examination by indirect ophthalmoscopy using 20D lens. A baseline OCT was done on upper swami OCT 2 days prior to procedure. Intravitreal bevacizumab injection 1.25 or 0.05 ml was injected 3.5 to 4 mm from limbus infratemporally under topical anesthesia. Post-procedure antibiotic eye drops were instilled four times a day per week. All the patients were treated with 3 injections of Avastin with a time interval of 1 month between each dose. All patients included in the study were assessed preoperatively for visual acuity and central macular thickness. After the first dose of injection, patients were examined on post-procedure day 1 and follow-up monthly for 3 injections. Statistical analysis was performed using SPSS software. Results: the mean age of the patients in my study was 58 years. All the patients were diagnosed as type 2 diabetes mellitus. Mean duration of diabetes in my study was 11.25 years. All the patients were treated with 3 injections of bevacizumab and at 1 month interval for each injection. Visual acuity and macular edema were evaluated monthly and prior to procedure and follow up until 3 months. In our study, a sample of 27, male are dominant than females, 74%. Laterality of the eyes: right eye is more than left eye. And type of diabetes are moderate NPDR are 38% and severe NPDR 50%, very severe NPDR are 4% and PDR are 8%. Comparison of visual acuity before intervention and monthly follow-up. Best corrected vision less than 660, I have 7 patients, and from 630 to 636 to 624 we have 9 patients, 618 to 612 we have 11 patients pre-operatively, a total 27. After first month of injection, the visual acuities are gradually going better, that patients were reducing from 660, the number of patients from 660 are reduced to 3, and later after first month after second injection they were reduced to 2, and first month after third injection they were reduced to 1, with a p-value significant of with a p-value of 0.03 and 0.01, less than 0.01. The mean comparison of logmar units of BCV at pre-intervention and post pre-intervention and monthly follow-up. Pre-intervention there are 7 patients with logmar unit 1, and mean logmar units is baseline mean logmar is 0.67 plus or minus 0.3, and after 1 month after first dose the baseline was the logmar value was 0.48 plus or minus 0.28. 1 month after the second dose the logmar was 0.43 plus or minus 0.
Sorry to intervene, I think time is already over. Can you conclude at least? Go to the conclusion. Read your conclusion.
There is significant reduction in central macular thickness at the end of follow-up as compared to baseline, and significant improvement in BCV at the end of follow-up as compared to baseline. And there are no complications at the end of my study. This says the bevacizumab is safe and effective.